Genital herpes is a common sexually transmitted infection, or STI. It affects both men and women. However, women are more susceptible to contracting the virus. This is due to the nature of their genital tissue, which can make it easier for the virus to enter the body. Genital herpes is caused by the herpes simplex virus, or HSV. There are two types of HSV, HSV1 and HSV2. Both types can cause genital herpes, although HSV2 is the most common cause. Genital herpes is a lifelong infection. There is no cure, but antiviral medications can help manage the symptoms and reduce the frequency of outbreaks. It's important to understand that many people with genital herpes have no symptoms or very mild symptoms. They may not even know they have the infection. This is why getting tested for STIs, including genital herpes, is essential, especially if you are sexually active. The virus can be spread even when there are no visible sores or symptoms. This is why it's important to practice safe sex by using condoms consistently and correctly. It's also crucial to have open and honest conversations with your sexual partners about your sexual health. Knowing your status and sharing that information with your partner can help prevent the spread of STIs. The herpes simplex virus, or HSV, is a common virus that causes infections with lifelong consequences. There are two main types, HSV1 and HSV2. HSV1 is typically associated with oral herpes, causing those familiar cold sores around the mouth. However, it can also be transmitted through oral sex to the genitals, leading to genital herpes. HSV2, on the other hand, is the primary culprit behind genital herpes. This virus spreads through direct skin-to-skin contact, usually during sexual activity. It's important to note that HSV can be transmitted even when there are no visible sores or symptoms present. This is because the virus can shed from the skin even in the absence of an outbreak. Transmission occurs when the virus enters the body through tiny breaks in the skin or mucous membranes. This can happen during vaginal, anal, or oral sex with an infected person. Once inside the body, HSV travels to nerve cells, where it can remain dormant for long periods. Genital herpes is characterized by periods of active infection followed by periods of dormancy. During an active infection, symptoms can range from mild to severe. The first outbreak is often the most noticeable. Symptoms usually appear within 1 to 3 weeks after exposure to the virus. These symptoms might include flu-like sensations such as fever, headache, muscle aches, and swollen lymph nodes in the groin. The hallmark of a genital herpes outbreak is the appearance of painful blisters or sores. These sores can develop on the genitals, buttocks, thighs, or anus. In women, sores may also appear inside the vagina or on the cervix. The sores may break open, weep fluid, and eventually crust over, taking a week or more to heal completely. During dormant phases, the virus retreats to nerve cells near the base of the spine. It remains inactive until triggered by certain factors. These triggers can include stress, illness, fatigue, menstruation, or even sun exposure. When reactivated, the virus travels back down the nerve pathways, causing a recurrence of symptoms. Diagnosing genital herpes often involves a physical examination by a healthcare professional. They will look for characteristic sores or blisters. If an active sore is present, a swab of the fluid can be collected and sent to a laboratory for analysis. This helps to confirm the presence of the herpes simplex virus. While there is no cure for genital herpes, antiviral medications can significantly reduce the frequency, duration, and severity of outbreaks. These medications work by suppressing the replication of the virus within the body. Commonly prescribed antiviral drugs include acyclovir, valacyclovir, and famciclovir. Prevention strategies center around practicing safe sex and maintaining open communication with sexual partners. Condoms, when used consistently and correctly, can significantly reduce the risk of transmission. However, it's important to remember that condoms do not provide complete protection, as the virus can still be spread through skin-to-skin contact in areas not covered by the condom.